Hello, my name is Dr. Arun Panda. I'm a facial plastic surgeon. I practice in Mumbai. So we're going to discuss about facial feminization surgery. FFS, which is very commonly known as, is a very popular procedure which is being practiced since like late 2000s, and it has been very popular nowadays amongst the trans women. It's a gender reaffirmation procedure which is being performed very often now among the trans people, the male who gets converted into a female. Today in the country, a handful of surgeons today practice FFS or facial feminization surgery. That's because of the complexity and the understanding of the facial bones and the facial structures, the differences between a male and female. So we're going to talk about the differences and how I perform facial feminization surgery. So as I said, FFS is a gender affirmation procedure which is commonly performed along with the other procedures like breast augmentations and other sex reassignment surgeries. So FFS is a procedure wherein we try and modify the facial features of the male into a female. Like the male has got a masculine feature, we're going to convert them into a more feminine feature. So let's try and, this is a skull, I'm going to try and explain you all the procedures, surgical procedures which we perform on the face to get a more masculine features of a male into a more feminine features. Okay, so let's start from the upper part of the face. In the upper part of the face, we have the forehead. In the males, you would see the forehead is quite prominent. So it's called as the forehead bossing. So what we actually do in FFS is basically we try and trim this, the frontal bone or the forehead bone. That actually gives a nice slope, like a feminine, more of a feminine feature. Next, as we go, we do something called as a brow bossing. So the supraorbital margin or the eyebrow bone is very prominent amongst the men, or it's a very masculine feature. So what we actually do here is basically this brow bossing is also kind of taken care of by a flap which is raised right from the hairline. So we raise the flap right from the hairline, go here, and we trim this forehead and also the brow. So this brow could also be extended to the lateral part, because sometimes this lateral part of the eye orbit is also very prominent. So we trim this also. So that's about the upper part of the face. Now as we go little down, so we have the nose. So what happens is the male nose is quite wide and broad, while the female, it is quite sharp and prominent. So we do something called as the rhinoplasty, wherein we make the nose little sharper. It's come little down, so we have the malar prominence, this zygoma or the malar prominence here. For a female, this zygoma or the malar area is very prominent. I'll be discussing about this case very soon, wherein like I have done a FFS for this person, trans person. So I'll be explaining, but before that, what I was trying to talk about is the zygomatic prominence. So for a female, this zygoma is, we have to look into the face of the person, and then we have to decide how much of a prominence we have to make that, because a prominent cheek for a female, it looks nice. As we go down into the mid face, so we have this buccal pad fat. The person looks very chubby, like a masculine feature, it is very chubby here. So we do something called as a buccal pad fat removal, wherein we take out all the fat from inside, so that this part of the cheeks, it goes inside. Sometimes these patients also ask for a dimple creation, which is a more feminine appearance. Okay, let's go down a little bit more. So one of the most important feature of a masculine face is basically the lower border of the mandible or the lower jaw. It is very right angle here at the corner of the mandible. It is like 90 degrees. So what happens is, for a male, it is very if you see that, it is very prominent, the angle is prominent, and the chin here is very wide for a male. So what we do in a FFS surgery is basically we try and trim this angle of the mandible here like this, and shape it up and make it more obtuse. And as we go forward, we kind of trim the lower part of the mandible also, or the lower jaw also, and make this chin very prominent. So that actually gives a more tapered appearance of the lower jaw, and which looks more feminine. Apart from that, We also do a few more things, which if the patient asks us for, as I mentioned, something called as a lip lift surgery also, if you want to lift the upper lip up. These procedures, when performed, so they gives a more masculine face into a more feminine facial appearance, and which is very important for a trans woman to face the world. Yeah, so as I was discussing about this patient, if you can see here, so I have done a forehead trimming, we have done a hairline lowering, I have done a hair transplant, we have done the brow trimming also, we have done a rhinoplasty, I have done the angle we have cut, and we have done a genioplasty here. And that's how the patient looks so feminine. So these are the procedures which we normally do, and most of the times we break it up into two parts. We do the upper part of the face first, and then we go for the lower part. So that's about the facial feminization surgery, or the FFS. If you have any queries, you want to know more about it, you feel free to call us or get in touch with us. We'll be more than happy to help you. And if you like this video, please do not forget to subscribe and like this channel. Thank you so much. Dr. Arun Panda, facial plastic surgeon, Mumbai.